Is depression always caused by something? Or is it like the weather that just comes sometimes and then you have to wait for it to pass? Well, in this video, you'll hear from licensed clinical professional counselor Peter King as he explains if depression is treatable or if it's just a reality that you have to live with. Hey, it's Clint with Sandstone Care, where we help teens, young adults, and their families overcome challenges that come with substance use, addiction, and mental health conditions. All right, let's get right to it. And when I think about depression, I know I've heard people who describe depression as like weather, right? Like it just comes.
Yep.
And you just kind of have to wait for it to pass. Is that a healthy way to look at depression, or is depression really the result of, something that's unaddressed or something that hasn't been figured out? I know, especially when we think about parents and we think about relationships,
Sure.
we think about how oftentimes the husband or the spouse or whoever will try and fix the problem that they see that the spouse is going through, right?
Right.
Or the parent will, try to fix the problem that they see their child is going through.
Yeah.
But if depression isn't something that's fixable, or if it's not something that's treatable, if it is just like weather, then you just kind of have to wait it out. So, from your experience and your opinion, is depression something that is innate, that we're just born with, or is it something that we develop and that we can treat?
So I'll answer it first saying that depression is absolutely a condition that can be treated. Now, if we're looking at addiction or we're looking at depression, we're not really looking at a cure. It's not like, taking penicillin or taking antibiotics and then being able to wipe out an infection. It's really, addiction and depression really take long-term work, and they are manageable and they are treatable. People can inherit like a predisposition for it. And so, especially we see in families where if a parent or say a grandparent has a mental health disorder or has an addiction, there is a genetic predisposition that people can inherit. Now, that's not a guarantee that somebody will, have depression or be born with depression, because it's, our genes, we interact with our environment all the time. And so, based on someone's life experiences, right? Like if somebody, let's say that somebody grows up in a really, secure household, secure attachment, there's a lot of love, a lot of affection. Those are protective factors against depression developing. Now, if somebody grows up in an environment where there's a lot of chaos, or maybe a parent is dealing with their own depression, their own struggle, and they're not as available for the kid, we see a much higher likelihood of depression developing. And a lot of depression does happen, in the context of relationships. Like depression can be worsened if there's like a romantic breakup, or if there's, loss of a friendship or distancing of friendships. And so I wouldn't say that it's innate, but I would say that, the potential is there, and then how somebody interacts with the environment, and I would say how the environment interacts with them too, really plays out if that happens.
Which is encouraging for parents and for spouses.
Yeah.
Really anybody who knows somebody who is understandably depressed, right? Or has gone through something, an event, a trauma, a trigger that has caused depression.
Right.
If you want to learn more about treatment options for you, your teen, or young adult, then tell us about your situation on a confidential call using the number linked up in the description box below, or live chat with us at sandstonecare.com. We'll connect you with the treatment that you need, and if we're not the right fit, we'll get you where you need to go. Be well, and remember that change is possible.